And that's what we do on Health Watch. We educate and inform everyone, from men, women, and children. Moving on, our next feature is on the role of a pharmacist in the health sector. Trust me when I say a lot of us know the chemist. The common name is, oh, chemist, chemist, chemist. But what's the difference between a chemist and a pharmacist? Find out on this interview. We'll be right back.
So, a pharmacist has spent time studying medicines, and because over 80% of medical interventions requires medicines, you must ask the question, so what is going on? Why would anybody spend time on just that component? It is because medicines normally are poisons. Even paracetamol is a poison to your liver if you overuse it or abuse it. So some people have actually spent time to understand the components that you are consuming. And anytime you are consuming medicine, you need advice. You need to be guided. You need to know what to expect, which could be side effects, or you need to even know that there's some adverse effects that nobody can anticipate that might come up. And you also need to know that even normal eating can interact with the medicines you've taken. Other medicines, herbals that you're taking can interact. So many things can happen when it comes to drugs. And the pharmacist has spent 5-6 years to become the knowledgeable expert. So with the pharmacist, you're safe. And most people that abuse, misuse, or access counterfeited drugs, it tells on them. Some abuse can lead to fatality, meaning death. Some can lead to damage of internal organs, such that sooner or later it will show that you are not all right. So we try to make sure people are careful with drugs. We treat it with care. We know the effect of drugs on the body, and we know the effect of the body on the drug. Because drugs have to be excreted properly. And if they are not, you find some people say, oh, I can't urinate. That's terrible. You find some people using drugs on the biggest organ of their body, which is the skin, and they're using it for children. Pharmacists are alarmed, because if you get your child, addicted to some things, it will tell later on their organs. So there's a lot going on with medicines. Well, it's a lot of ignorance. I would never buy a drug that is being hawked on the street, because I know the effect of the sun on drugs. It fries the drug, so to speak. The heat is not good on most drugs. In fact, you see some drugs like liquids in brown bottles, amber bottles. There's a reason why. It's because the sun must not interact with that medication. We know these things, but if you say, I want to buy from a cheap source, you might be endangering yourself. You might be taking a medication that has been activated by the heat of the sun or the light from the sun, and then you're taking something that has already been activated. It might not be safe. So I would say shun those routes. Unfortunately, it's become so porous to bring in medication in those forms, because we have a very arduous task for our regulators. They can't cope with the level of proliferation of these counterfeited medicines. So that's why you find them on the streets. You won't go to some better regulated countries and find them. So we're working hand in hand with the regulators to make sure people don't use them, people are better informed, and people know the dangers. There are some people with their tie, their suits, they hang out at some street corners to take a shot every morning on their way to work. They say it boosts them. You don't know if it's steroids they are taking. And the end game of misuse of steroids is complete organ failure. It becomes too late to understand that it's those things, amphetamines and stuff, that it has been put inside some concoction that you didn't know you were taking, that are stimulants, but they've been damaging the liver, the kidney, the heart. They all collapse around the same time. And we're seeing more cases of cancer. We're seeing more cases of conditions that really should not be proliferating. But those things are happening from misuse of drugs. What you call a chemist is a patent medicine store owner. This is someone who came forward to our regulator and said, look, I found an area in the rural area or in the suburbs that is underserved. I would like a license to sell simple over-the-counter medicines to people there. They are meant to serve over-the-counter simple medication that really, if you guide them here and there, they should be able to. But right now we even have tiers of these patent medicine store vendors. There's tier 1, tier 2, tier 3, and it's getting better. But what you find is when a so-called patent medicine store vendor or a chemist then begins to take on more than he should be doing, takes on prescription medication, takes on medication that are dangerous, and then gives it out. For example, some would give you 2 capsules of Ampiclox and say you want to wash your blood. What are you washing? You're simply teasing the bacteria, say hi, and then they go strong when you don't work again. And we are creating resistant bacteria. It now becomes harder to kill them when there's an infection. So we try to make sure people are educated that what you should be buying from them are over-the-counter medicines. Paracetamol, vitamins, things for malaria, not too complex things. You might harm yourself. You might get away with it 10 times. The one time you don't get away with it, it could lead to danger. It could lead to a lot of stress. It could lead to hospitalization. Then you now go and spend a lot of money in the hospital. Or it could lead to fatality, or it could lead to damage.
So now you know the difference between a chemist and a pharmacist. The interesting thing about this program is that whatever aspect it is, we'll ensure that we'll touch it, we'll get the professionals in the field, and they expose these things you need to know. All right, so next time you go to the pharmacy to get your drugs or your prescription, you now know the difference between a pharmacist and a chemist.